Hello, my name is Kelly Schmidt. Welcome to D439 Foundations of Nursing. Today we will be going over ethics and values, chapters 22 and 23. Nursing ethics can be summarized as an in-depth look at the ethical and bioethical issues that arise with respect to the core concepts of nursing. This relates to the person or the patient, the promotion of the health of that individual, and along with the prevention of illness. This also applies to the nursing culture and the practice itself. Nursing ethics provides specific guidance to the nursing profession regarding moral issues encountered throughout the nursing career. The goal of nursing ethics as a discipline is to assist in the resolution of moral dilemmas encountered by nurses. Some common ethical principles that we will go over. Just a few. The first one is justice. This is a belief that everybody is entitled to be treated fairly. This equal distribution of limited resources is best recognized in an emergency department triage area. For example, someone who is high up or the CEO of a Fortune 500 company should not be given a priority over someone who may be homeless if they have the same diagnosis and need. If both patients are being seen for a broken leg, they should be treated equally and fairly, unless one of them has a more severe need than the other. Utility is the concept of the good of many outweighs the needs of one individual. The rightness of the action or behavior is determined by the outcome of the action or behavior, which will result in the greatest good for the largest number of people. An example of this can be seen with the COVID-19 virus. Many patients with the COVID-19 virus felt isolated and alone because they were kept in a completely closed-off hospital room with no visitors and limited hospital staff. But their isolation and emotional discomfort at the time was necessary to protect others from being infected with this highly contagious virus. Non-maleficence. It is the basis behind the phrase, the duty to do no harm. Both the medical and nursing profession base their entire professional code on these 6 words. The duty to do no harm. Not only does it mean preventing harm, but it also means correcting any harmful situation that may have occurred unintentionally. For example, you may have a colleague who might be chemically impaired while they're working and taking care of patients. As the nurse and as that patient's colleague, you have the duty to report that abuse to protect the patient. The ethical principle of autonomy is the freedom of choice regardless of what the choice may be. It is an individual's right to determine his or her own actions. It requires respect for individuals and is the foundation principle for informed consent. To have autonomy, the individual must be free of mind-altering medications or drugs and able to reach reason through treatment expectations, options, outcomes, and the goals of treatment. Sometimes we have surrogate decision makers. These decision makers are often used during times of medical emergencies to make decisions for patients who are currently incapable of making the decision for themselves. Surrogates are legally required to make a decision that the patient would most likely want if they were given the opportunity to make the decision. This decision should be based on religion, values, and morals of the person they are deciding for, not based on the surrogate's own personal values and morals. This way, the surrogate decision maker continues to provide the respect for autonomy and well-being of the patient. Can a conflict occur between a surrogate and a patient? Absolutely. Fidelity. It refers to the faithfulness and the keeping of promises. It's the honoring of a commitment. Nurses are expected to have multiple commitments to their profession. A commitment to the healthcare provider or other medical colleagues, the institution or employer, and the patient. According to the American Nurses Association Code of Ethics for Nurses, the patient's primary commitment should always be towards the patient. However, sometimes it is not easy to put the patient first, because the nurse may encounter a situation in which being faithful towards the patient could jeopardize the relationship with a medical colleague or even the institution. I'll leave this visual up for a few moments. When you graduate from nursing school and pass the nursing certification board, you will obtain a license to practice nursing in your state. This license sets the standard and guidelines you must follow throughout your nursing career, and you will be expected to act in a manner according to what is reasonable and competent and what a competent nurse would do in a similar situation. Nursing laws are constantly being evaluated and amended, and it is your responsibility to keep up with the changes and how it will affect your nursing practice. Knowing the rights, responsibilities, and risks can help nurses make well-informed decisions and provide safe patient care. Lawsuits can be brought against nurses by patients. Torts are civil lawsuits against a person or a person's property because of behavior that resulted harm or injury to another person. Torts are characterized as intentional or unintentional behaviors or actions, and they result in awards of monetary value to the injured person. Included in tort lawsuits are situations in which there is a failure to act or a specific negligent act that ultimately results in harmful outcomes. An intentional tort might be assault or battery. Assault is a threat made against a person that makes them feel fearful. For example, if you were to say, if you don't stop acting up, I'm going to tie you down to the bed, or I'm going to hit you. These are threats against a patient, and this is assault. Battery is the touching of a patient without consent that causes harm. For example, you administered a medication to a patient after they refused, or you did tie a patient down to the bed by using restraints without consent. Intentional tort can also be false imprisonment, slander, libel, breach of client or patient privacy. What is false imprisonment? It's the act of keeping someone somewhere against their will. when they should be free to go. The tort of false imprisonment denies a patient their autonomy, and patients have the right to leave, even what is against medical advice. Slander is a defamation of character that is spoken. For example, in nursing, if you were to gossip about a patient out loud to another nurse, did you hear that patient did such and such and such? Even though you knew it was untrue. Libel is when this defamation of character is written. For example, if you made an internet post about the gossip that is known to be false, or printed out signs and hung them up in the hospital, and you knew these statements were untrue, that is libel. Think of slander as spoken word. S for slander, S for spoken word. L, libel being written, and you look for written books in a library, right? Written books in a library, L for libel, L for library, and slander, S for slander, S for spoken. Then we have unintentional torts, such as negligence or malpractice. This is defined as doing something or failing to do something that a prudent, careful, and reasonable nurse would do or not do in the same situation. For example, a nurse may not have followed the right fall procedures. Maybe they did not give medication in a timely manner or failed to perform a procedure that he or she was intended to complete. If the nurse's actions led to injury or death of the patient, a nurse malpractice claim could be filed. Delegation in nursing is defined as giving someone the authority to perform an action on one's behalf. This includes delegating to other RNs, LPNs, LVNs, or certified nursing assistants, emergency medical techs, and possibly unlicensed assistive personnel. When making the decision to delegate, the nurse, not the employer, is responsible for knowing if the delegated task is appropriate. If the delegate is unable to perform the job appropriately, the nurse is held accountable for the outcome, not the employer or the organization. For nurses, the liability associated with delegation has increased as the nursing shortage has progressed. The 5 rights that are presented in this graphic are to ensure safe patient delegation. Documentation of incident reports. Incident reports are made when a potentially dangerous or life-threatening event occurs. Nurses are required by law to report critical incidents to upper management and the risk management department of that healthcare organization. They can be seen as time-consuming, but they're necessary to improve patient safety and quality of care. It also keeps the rate of critical incidents low. Once an incident report has been filed, the issue is investigated to determine whether an employee deviated from the standard of care. Investigators from the risk management department have the job of identifying what needs to be changed, improved, or prevent future incidents from occurring. This can be patient injury or harm to a patient. This can be an unanticipated passing of a patient, a malfunction of medical equipment, a significant or unanticipated reaction to a therapy or medication. It can be because of the inability to meet patients' needs because of inadequate staffing, patient or family refusal of care, incomplete or ineligible prescriptions, or a statewide issue such as medication or equipment is unavailable. We can also report incident reports for toxic spills, fires, or environmental emergencies. Violent behavior by a patient or family member can also be included on an incident report. Unethical and illegal or incompetent practices can also be recorded. Electrical hazards, loose carpeting, and delay in repair of equipment can also be an incident report. Documentation. It is estimated that 1 in 4 malpractice cases are decided based on what is documented in the medical record. The nurse's best defense is accurate and timely documentation of patient care, specifically the type of care administered, the time the care was administered, the overall status of the patient's condition, and finally, evidence that the standard of care was met. It's really difficult to prove that appropriate care was provided if it's not documented. If it is documented, then it can be proven that it was done. The do's and don'ts. Know the documentation policies of the institution and unit, particularly acceptable abbreviations. Do not document personal notes about what others did or did not do, or what should have been done by someone else. Charting must only reflect the nurse's own actions and the patient's response. Do not document a patient problem without documenting the action taken to address the problem. Be objective and chart the specific details. And document why something was not done. If it is something the nurse would normally do, for example, patient not ambulated as patient refused to get out of bed. We should document at the time of the event. We might need to note if there's a late entry. We may need to ask a manager or someone else for assistance. We should document healthcare provider rounds or visits. And we should document all phone conversations as well. Informed consent is required before any medical treatment or procedure. This consent may be expressed verbally or implied with action. Implied consent is inferred when a patient walks into an emergency department seeking care or treatment. The patient does not have to verbally express that he or she is consenting to medical treatment. However, for the patient to make a choice about specific healthcare procedures or treatments, the patient must fully understand the risks, benefits, side effects, and available alternatives. The patient must consent voluntarily and have the ability to accept or reject alternatives. The patient must be mentally competent to give consent. The patient must be mentally competent to give consent, meaning that the patient cannot, the parent must consent for a minor younger than 18 years of age. Another family member or guardian must consent if the patient lacks mental ability, such as a low IQ, dementia, or under the influence of drugs or alcohol. When the nurse healthcare provider is obtaining consent for a procedure or treatment, the role of the nurse is to witness the consent, but is not to explain the procedure to the patient. However, the nurse is not responsible for ensuring that this healthcare provider gives a clear explanation. The nurse is only responsible for ensuring that the patient is competent and communicating back with the healthcare provider if the patient revokes consent about an upcoming procedure or treatment. The nurse should never obtain consent for a procedure if the procedure has not been thoroughly explained. A certified medical interpreter should be used for consent for non-English speaking or hearing impaired patients and families. Using a family member as an interpreter is not appropriate, as there is no guarantee that the family member is interpreting the information correctly. Cultural barriers, family dynamics, or medical literacy may also prevent a family member from interpreting correctly. Delegation and documentation are just some of the select professional liability issues that can have a significant legal impact on the nurse's career if workplace procedures and nursing standards of care surrounding the act are not followed. Nurses must follow the correct delegation, and they are required by law to report critical incidents, known as incident reports. The nurse's best defense in most legal situations is accurate and timely documentation of the care that was provided. And informed consent enables the patient to make a choice about specific healthcare procedures or treatments with full understanding of the risks, benefits, side effects, and available alternatives. I will leave the summary page up as well for you to review. Thank you and have a great rest of your day, and thank you for joining me. Please reach out with any questions.